Well, Professor, one of the things that a number of people have also, alluded to is the possibility, one of the possibilities is that maybe it's because the fatalities is not so high, and consequently people are saying like, look, people aren't dropping dead all over the place, so what's all the hoopla about? So maybe that's one of the reasons that say, look, we're going to die of one thing anyway. There are deadlier diseases in Nigeria than COVID-19, and a good number of people actually fully recover from it. How do you react to that?
Well, again, if we are waiting for people to die on the road before we intervene, then there's no need to have doctors, because we have what we call preventive medicine. We want to prevent. We don't want people to die. Doctors are trained not to be looking for dead people. We are trained to prevent people from dying. And even if we say so, let there be evidence that people say they are not seeing people dying. How many people have Nigerians seen dying, even in the hospital? Not to talk about a situation where the whole world is on its knees because of COVID. So that issue, that statement is, I think, is largely for those who are illiterate. Nigerian doctors and doctors anywhere would not want any one of his patients to die. And we have a branch of medicine called community medicine and preventive medicine. This is the discipline that ensures that people do not die. We intervene early, prevent deaths, prevent ill health, and promote health. And in that case, that is what we as doctors will continue to preach, and what we will propagate, that what we advocate, and what we will engage with government to do, so that we do not need people to die or to be seeing dead bodies on the road before we can believe that there is COVID-19. Nobody that dies is being put on the road from other diseases put on the road. So why should anybody be on the road before dead? Should die and be placed on the streets before Nigerians will believe. In any case, Nigerians do not believe in anything except how they can get money. Now, what we are looking at is that we should ensure that people should be well. They should not die. And if they are not going to die, and we wish that they don't die, then we must prevent the deaths. And these are some of the strategies that we put in place. And I think that National Orientation Agency and other organs, the press is doing its best, but other organs in various languages should begin to let people know. I think that we have lost a lot of time in terms of information dissemination. I don't know why the much we expect from National Orientation Agency is not happening. I'm sorry, but that is true. I monitor many of these activities as the president of Nigerian Medical Association, how we can reduce the incidence, reduce the fatalities, reduce the ill health. And in fact, it's not just health. As you can see, the economy is affected, social activities are affected. Therefore, every component of human development is affected because of COVID-19. And nobody should have the illusion that COVID-19 does not exist. Even policymakers are making statements that COVID-19 does not exist. And it's very painful when the whole world is on its knees because of COVID-19, and then somebody will come out and say that it does not exist. I think that is misinformation, and that is disinformation.